thank you very much for the opportunity to present to you today, especially to Professor Kinam. It's a pleasure, and I very much enjoy presentations in South Korea in general, because I always find it very enlightening and very instructive to compare both Germany and South Korea, as they are very similar in terms of target audience, although very different in terms of the geographic area that they service. But I always find a lot of similarities between the two, and I'm sure you will see them as well. This is what I have planned for you today. I'd like to focus on the impact of COVID-19 on the medical tourism to Germany, and especially on the path forward. But to do that, I believe it is necessary to just share some quick information about medical travel to Germany in general with you, to give you some background and to better assess what's actually happening here. So I'd like to share just 4 characteristics really quick for you to learn a bit more about medical travel to Germany. In Germany, we have both public and private providers, and all of these are very deeply rooted in our domestic healthcare system, which is a key feature, which in a way helps and at the same time restricts medical tourism, as you will see. It's also important to know that international patients are not crucial for providers in Germany or in the grand scheme of things. They're very marginal for the single provider, although total numbers across all hospitals are fairly high. There is a bit of a focus on complex inpatient treatments in terms of international inbound patients, but you should also know that up to 80% of total treatments are actually outpatient treatments. And we don't know very much about that, or at least about the treatments that occur beyond the hospitals. So that's quite different compared to the excellent data that Professor Kinam has to share about South Korea. You should also know that the treatments that are provided by providers in Germany or by hospitals, they're very substantially. That is, we have, for example, university hospitals that focus on very complex treatments, particularly in the fields of oncology, neurology. But there are also private hospitals, and their specializations range across all the different treatment types. Typically, they don't provide everything. They focus on a few particular treatment groups. But across all these different private hospitals, a lot of different treatments are provided. And a final feature you should know as a backdrop to the information I'm going to share about the impact of COVID-19 is that there is very little to no government support of medical travel in Germany. It's very limited. That's one of the reasons why international patients are not the main focus of most providers. Another reason is that our providers are actually restricted by our public fee schedules. That is, you cannot charge international patients more than a public or private patient in Germany, which is very restrictive for a number of reasons. For example, you cannot pass on interpreter fees very easily and other costs that you incur. So that's just for a quick backdrop of inbound medical tourism to Germany, which will be important as we look at the impact of COVID-19. Here's a quick overview of the treatment focus of international patients in Germany. So as you can see, all the way up there are oncological treatments, ICT-2 treatments. That's by far the largest type of treatment that's being provided, and it's also the most rapidly growing group. But then as you look across other treatment types, the circulatory system, nervous system, skeletal system, and connective tissue, they're all there, essentially, with oncological treatments being on the top. And finally, to know a bit about the regional focus, I said it's very similar in terms of treatments that South Korea provides, but in terms of the regional focus, it's of course different. You see a bit of a regional focus in Europe. So Germany services a lot of patients from neighboring countries. Of course, Russia is very far up there. Next in line are the Middle East as a particularly important source region, and Central Asia, so CIS countries. Let's turn our attention to the actual impact of COVID-19 in terms of treatments. What we can see is that there has been an overall increase in demand an overall decrease in demand for treatments in Germany, but it's very substantially by regions. And as different providers provide different treatments and service different regions, they haven't all seen that effect of an overall decrease. In fact, there are some providers that report that they haven't seen a decrease in demand at all. A second important thing to point out, and that this runs a bit counter to what Keith said earlier, the conversion rates are up tremendously. That is, any lead essentially leads to an international patient at the moment. There could be different reasons for that. It could be that either Germany is perceived as sort of a safe island in Europe, or it's the particular treatment types that Germany provides that are deemed to be essential oncological treatments, or it could simply be that supply elsewhere is down, which is a main suspicion, which leads to very high conversion rates at the moment. That being said, the actual treatment numbers, so not what's being demanded, but what's actually being delivered by hospitals, is down by up to 90%. Again, varying a lot on the different treatment type that's being provided. What we see is that a lot of patients have canceled their short stay outpatient treatments, or had to cancel them due to travel restrictions. But there are some providers that report essentially no change in the treatments delivered or the demand observed. And these are providers that deliver largely oncological treatments to international patients. We have also seen that some of the patients that were stuck in Germany and couldn't travel back home engaged in additional treatments. So these were particularly checkups for the most part. And another interesting impact of COVID-19 on treatments is the COVID-19 patients themselves. There are anecdotal reports of actually private out-of-pocket payers who travel to Germany to receive a treatment, but most of the providers in Germany reject treatments of COVID-19 patients for different reasons, either for hygiene reasons or for budgeting reasons. These patients are very difficult to budget. It's very difficult to predict the costs. So they're not very attractive for many of the hospitals. They're very risky. At the same time, what we observe in Europe is that there's an institutionalized patient transfer across national borders. That is, we have observed different initiatives at the federal level, at the state level, sometimes even at the municipal level, to support neighboring countries in Germany. And COVID-19 patients have been transferred to German hospitals for treatment. What can we say about the impact of COVID-19 in terms of source regions? We have, in terms of demand, there seems to be quite a stable, or even some providers reported increased demand from Russia and Eastern Europe. On the other hand, the travel from the Middle East has essentially seized up. And the main reason there is that this travel is typically institutionalized, that it's, it goes via embassies. And as all the personnel had been sent back, the travel dried up from the Middle East. That's very much in line with what we observe in terms of medical visas. It's still possible at the moment to receive a medical visa in Russia, whereas there's basically no medical visas being issued in the Middle East. And finally, what we can state is that that travel is one of the main problems for medical tourism at the moment. It's the bottleneck for some of the key source regions that Germany usually attracts international tourists from or international patients from. Flights are being canceled, rerouted last minute. There's some increase in private travel among the group that can actually afford that, or among patients that have the option to travel privately, for example, by car. Some countries, such as Ukraine, that don't require medical visas, and they do actually travel by car to Germany. So that can be observed, but the large bulk travels by flight, and that's a real problem in terms of logistics at the moment. So what is the actual path forward that providers in Germany anticipate, rather? Well, what we can see is that there's a shakeout in terms of service providers in the sector. Facilitators, small insurances, they consolidate or disappear from the market, essentially. Many of these small facilitators and small service providers cannot survive such an extended time span that we're experiencing right now in terms of COVID-19, and they have either consolidated or disappeared. As for providers, we anticipate that some of the smaller hospitals will probably abandon medical travel, but the larger players They are just shifting their resources to the domestic system at the moment, and they are likely to shift them back to international patients as they can. And this is what I meant earlier, in that German providers are very deeply rooted in the domestic healthcare system. They're so busy and occupied with German patients at the moment, and international patients are such a small share overall. This is not a big problem to stop servicing international patients for at least a limited period of time. In terms of a catch-up effect, that'll be interesting to see. We've received very different feedback on that. We would expect some sort of backlog of elective treatments, in that international patients might travel to Germany later to catch up on the postponed treatment. But that is very unclear. Some of these elective treatments of possibly more acute character may be treated at home. Other providers do expect such a backlog, but German providers are not quite certain as to what to expect here. What most of the providers do anticipate is an increase in checkups and these kinds of treatments post-COVID-19. And that is something that we're currently preparing for. In terms of source region, many providers do expect the demand from the GCC to decrease in general in the future for a number of reasons. On the other hand, we expect an increase in the future from Russia and CIS countries. We've run a survey in Russia, which hasn't been published yet, but the results are quite clear that the reputation of the German healthcare system has absolutely skyrocketed in Russia in both absolute terms and also in relative terms compared to other countries' healthcare systems. So we would expect at least a return to the previous level, or maybe even an increase in terms of international patients from this region. It's also quite interesting to look at Europe, and Keith has alluded to this earlier. Many providers do expect increasing interest from patients from neighboring countries, or they are experiencing that already. The UK has been mentioned in terms of the backlog of treatments there in the national healthcare system, but we're also looking at other countries, Czech Republic, for example. These are specifically countries that have suffered a lot, or whose healthcare systems have suffered a lot or struggled a lot with COVID-19. And apparently patients from these countries are the ones that are now looking abroad for treatments. I've spoken about the increased cross-border cooperation earlier, and that's something that might play a bigger role, or that some providers anticipate to play a bigger role in the future also. These networks that have been established now to transfer COVID-19 patients across European borders might also, or hopefully will also, serve to transfer other international patients later, but that's still very much unclear. So final point I'd like to speak about is the strategy. I've spoken about medical tourists who actually travel abroad to consume abroad, which is the mode of supply number 2. But what about the other modes? We would expect that providers engage in other modes of delivery to compensate for the medical tourism that has declined over the last 6 months. But that doesn't really seem to be the case in Germany. And again, one of the reasons seems to be that all these providers are so deeply rooted in the domestic system. Let me actually start with subsidiaries. Due to COVID-19, a lot of German hospitals weren't able to provide elective treatments to German patients, so they have very limited resources. That is something that they actually make money on also. And they have very limited resources at the moment due to COVID-19, and none of them are essentially looking abroad. As some large provider put it, the era of expansion plans abroad is absolutely over. And the same goes for travel abroad. So we do have a number of physician networks of physicians that travel abroad to deliver services to international patients, but that's very limited, and that's nothing that we expect anyone to focus on. In terms of telemedicine, I find that quite interesting. The answers ranged from anything from top priority to absolutely irrelevant. That is one of the reasons for that is, well, obviously some procedures, or many of the procedures that are being performed in Germany, they cannot be delivered via telemedicine, and they require patients to travel. But at the same time, we have a structural problem in Germany, and that is, as the providers are all bound by the German fee schedule, telemedicine in general is very unattractive financially. There are very small fees to be made, and as I've said earlier, international patients pay the same fees as German public or private patients, and it's just very unattractive for providers at the moment to deliver these services. So we might see some of the telemedicine in the conversion part, but as I said earlier, at the moment the conversion rates are up to 100%, so that's nothing that's immediately necessary, but that might be something that becomes relevant later on, to engage in telemedicine as providers are attracting patients, but then in the end most of the procedures are expected to be performed in Germany, or must be performed in Germany. Which takes me to my final slide, to the outlook. So as we can probably summarize that the mode 2 delivery, that is medical tourism or medical travel to Germany, remains the focus of most of the providers. And we've also seen in the data that both the absolute and relative reputation of Germany's healthcare system has increased. That is something that we can definitely also see for South Korea, as Keith has demonstrated. And South Korea has also been in the press here in Germany, but it's probably a very different geographic region, so the target audiences don't intersect very much, I would say. What we also see is that not just has the reputation of Germany's healthcare system improved relative to others, but the negative impact of COVID-19 has been stronger on many of the competitors' domestic healthcare systems. I've mentioned Czech Republic before, which has probably caused more Czech citizens to inquire about healthcare services in Germany. Another country that's often mentioned here is actually Turkey, which has suffered quite severely from whose structures have suffered quite severely from COVID-19. New cross-border networks are a very interesting option in the future. They may pave the way for for future patients, but that's really unclear. It depends a bit on the European regulatory framework there and whether or not anyone wants to push that at a policy level. But I said that earlier, medical tourism is not really on the political agenda here. So it's unclear whether or not these networks may be useful in the future. Overall, we would expect Germany to have a better relative position post-COVID-19, similar to South Korea in Asia. But in the end, that remains a prediction, and the actual outcome remains to be seen. Thank you very much for your attention.